Okay, so we have discussed previously the qualities of a doctor. You will have come across this had you done some work experience, had you read documents such as Good Medical Practice, which you can download from the General Medical Council website in the UK. You could download the standards document from the GDC, General Dental Council. You can download a similar document on the veterinary website, National Veterinary website in the UK. Similarly, you can do the same in Australia, New Zealand and Canada. And I'm sure for other countries throughout the world, there are similar examples of principles you'll come across. And in there, it is widely discussed in depth the issue of what qualities a doctor must have. What are the pros? What are the strengths a doctor must possess? And that's not just a medical doctor, it's the same for a dentist and a vet. A good doctor, for example, has real good insight. They have insight into what they're good at and what they are not so good at, their strengths and their weaknesses. A good doctor, for example, is able to marry the two together, marry academia to problem solving. So they are not just a really good scientific bod. They are not just good at learning and the academic side of learning facts and figures and regurgitating it for tests and exams. They are able to apply. They are able to problem solve with the armory that they have from learning. So they can take the theory, they can take the facts and be able to apply, be able to problem solve, be able to apply it to their clinical practice on a day-to-day level. A good doctor, a good dentist, a good vet is extremely proficient at communication. They are really good, they are slick, they use good language, they will make sure they're able to fluidly move from scientific jargon to lay jargon. They are able to fluidly move between empathy and sympathy, between conflict and agreement. So they are able to manage communication situations in an expert way. A good doctor also understands, believes and commits themselves to lifelong learning. They're bought in to continuous professional development, or CPD as we refer to it in everyday language. They understand that they have to learn throughout their lives and they are committed to it. So besides just working on a day-to-day basis, your doctor out there, your dentist, your vet, they are reading on a regular basis. They are all the time trying to improve their skills. They go on courses, they go on conferences, they do e-learning, they read, they do peer learning, they do critical appraisal work, they do audits, they do significant events, they do clinical governance work, all in the spirit of continually improving themselves, refreshing their knowledge and making sure people around them are equally proficient at their work. That's a really good quality a doctor will have. A doctor will also make sure that they stand up and take responsibility. They will actually take responsibility for themselves, their colleagues, their patients fundamentally. They will not absolve responsibility, they will not shirk responsibility, especially in difficult circumstances. They will be resilient in that sense. They will be really good at communicating and working with other colleagues and patients. They are good at teamworking. They know when to delegate, when to accept responsibility, when to take tasks, when to give tasks. They will know when to complete something. They will know when it's taking too long or too little time. They will be good at planning, at mapping and working in a team situation. Okay? When I mentioned resilience earlier on, that's another skill which you can actually look at it from a risk management perspective. They are able to deal with tough situations in a sensible way. What I mean by that is they won't put themselves or their colleagues or their patients in danger. Whilst maintaining safety at all times, they will do their best to look after themselves, their colleagues and their patients. That's resilience. They are really good, like I have mentioned in previous modules, they are really good at empathy. They are really good at connecting with their patients and understanding them from a person-to-person level. Last but not least, honesty, integrity, probity, candor. These are superior qualities which I suppose we would expect in any human being, anybody worth the cloth they're cut out of. But in medicine, in dentistry and in veterinary sciences, it is important not only to be honest, but also impose honesty around their team, around fellow colleagues and society as a whole. So we will not tolerate dishonesty. We will not be corrupt. We will not compromise honesty at any given situation. We will not collude with patients, with colleagues, with insurance companies, with product companies, with drug companies, and compromise our honesty and integrity. This is extremely important. When we go wrong, as no doubt we will do sometimes in our career, whether willingly or unwillingly, all right, we do make mistakes, we do go wrong. That's an acceptable part of being a human being. And so therefore, the regulatory councils that regulate our profession, they acknowledge that. They understand that. You know, so long as you've made a mistake and you're able to accept it and learn from it and become a better person, the regulatory bodies will accept that from us and will help us in doing so. However, what they will not compromise on is your ability or my ability to ignore honesty and continue with falsehood, with being deceiving and fraudulent and so forth. They will not tolerate this behavior of not learning from mistakes. They will not accept us not owning up to our mistakes, the duty of candor. So have a think about that and make sure, including the other properties, the other qualities I've mentioned before, we kind of encompass all of that in our strive, in our aspiration to become a doctor, dentist or vet.